Good morning you guys, it's Karen, and as promised I thought I would come and tell you the medications I'm on. I've told you the conditions that I have, so let me tell you what medication I take. I keep it in this pouch, which is lovely because it sits out on the dining room table, and so I wanted something that looked nice. There isn't much choice, I have to say, but I'll link this in case you also have a lot of pills. And then it's just got 7 days worth, and I've actually got 2 of these, so I do 2 weeks at a time. I sit down, it takes me probably about an hour, and I put all my drugs in for the following 2 weeks. I did do myself a little chart here of medication I was on, but I'm changing medication so much that it becomes outdated, you know. Like I had Topiramate. In fact, Topiramate is on here and I'm not taking Topiramate anymore. So I'm telling you the drugs I'm on now, and also drugs that I've tried, so that you can request a video on any of them if you're interested. I probably will forget something that I used to take because, you know, I've tried quite a few things over the years. The first drug I take in the morning is CANDESARTAN, and I take 4 milligrams twice a day. CANDESARTAN, also known as Amias, is for blood pressure, for high blood pressure. So I started off at 4 milligrams once a day and then increased to 4 milligrams twice a day. I think they want me to take 8 milligrams once a day because it's cheaper to, you know, get one lot of tablets at 8 milligrams than it is 2 boxes at 4 milligrams. But I don't want to do that because when I first started taking CANDESARTAN, it made me feel nauseous. So I don't want to increase the dose. And I just also prefer to have it spread over, you know, one morning, one night. So that's my blood pressure tablet. The second thing I take at the moment is BETMIGA. BETMIGA is the brand name, I think, but it's actually called Miragbaron, and that's for my bladder issues. But that's kind of the top-up drug, if you like, that I take, and I'm not sure how much it does. It's one of those drugs that it's made a little bit of a difference to me, but when I speak to my urologist about it and say, oh, I'm just going to stop it because it's barely making any difference, he wants me to keep on it because he said the longer you're on it, the better it will help you. But yeah, that's one of those that may disappear from my regime because I stopped taking it in the run-up to my urodynamics study and didn't notice that much of a difference. But you know, there's no major side effects or anything, but it is one that I'd potentially be concerned about taking forevermore. The final thing I take in the morning is paracetamol and codeine. When I wake up in the morning, my whole body is in pain, my joints are in pain, and so the first thing I do is take some pain relief, which is paracetamol and I was going to say a small amount of codeine. It's not a small amount of codeine to most people because I take 30 milligrams in the morning, but I could take 2 of those. If I was in an awful lot of pain, I could take 2 30 milligram tablets, but I just take 1 in the morning. I think codeine is probably the most interesting one to do a video on, the one that most people would be interested in. So yeah, I take that and I sit down and do my makeup and wait for my drugs to kick in, basically. So that's all I take in the morning, so not too much. Then throughout the day, it's a lot of what I take is supplements, and then I take paracetamol and codeine as much as I need to for pain, and then everything else I take in the evening. So in the evening, I take another CANDESARTAN for my blood pressure. As I said, I'm on 4 milligrams twice a day. The codeine, by the way, I should have said, I get prescribed the 30 milligram tablets, and I can take 2 of those up to 4 times a day. I try not to take 4 doses. It's rare that I take 4 doses nowadays, now that my headache's improved, thankfully. So CANDESARTAN, my high blood pressure tablet. Then I take 2 indigestion tablets. One is ZANTAC, which is the drug is ranitidine, and there's only 1 dose of that. I can't remember what it is, but I take that. I think it's 300 milligrams. The second one I take is LANSOPRAZOLE, and that is something that I've reduced the dose of recently. I used to take, now let me think, I'm on 15 milligrams, so I must have been taking 30 milligrams and I've reduced it to 15 milligrams. I'm hopeful that I can cut out one of those. Well, I'd like to cut out the LANSOPRAZOLE because that's the preferred one to not take long term out of LANSOPRAZOLE and ZANTAC. But I am having problems with indigestion in this last week or so, so I'm definitely keeping those up for now. The next thing I take is my AMITRYPTILINE, which is, you know, if I had to choose to take one drug that I couldn't really live without, it's AMITRYPTILINE, because it really does make a difference to the whole bladder. Now, I've been offered it over the years for my migraines, for anxiety, you know, for several things, but I'm only on a very low dose. I take between 20 and 30. I've been I had reduced it to 25 because I happened to have some 25 milligram tablets, but I then thought I could reduce it to 20 and it wasn't any good, so I'm back up to 30. That's making me really tired, so I might actually ask for 25 milligram tablets. I started on 10 and I have gone up to as high as 60 before to see if it could help the bladder anymore, and it just didn't. Amitriptyline is another one that is really, I think, an interesting drug, and I think worth persevering with if you get prescribed. Those are all the drugs that I take on a daily basis at the moment, apart from supplements, which I'll do a separate video on the supplements that I take. But there are other drugs that I add in as and when needed. So for example, for my allergies, I can go months without having any issues with allergies at all. And at the moment I'm not having any issues, but a few months ago, actually, before it got hot and before it got into the pollen season, I was waking up sneezing. Like from 3 o'clock in the morning, I'd be constantly sneezing until I woke up. My eyes would be pouring, and so I would take CETIRIZINE as a daily antihistamine, topped up by chlorphenamine, which is Piriton, and doesn't make me drowsy. I know some people really suffer with it. And then I've also got a nasal spray, and I'm actually using the nasal spray daily at the moment because I had a medication review with a GP and was discussing all of the drugs that I was on and which ones I could take as needed and which ones I needed to take constantly. And she was saying with the nasal spray is the best long-term antihistamine to use and should prevent me needing the others so often. So that's what I'm doing. It's called, I can't think of the name of it, and I don't know if I can even pronounce it. So I'll put the name of the steroid spray that I use on the screen because it's pretty good. I've actually stopped using my Vicks spray, which I was more or less addicted to. I used a Vicks nasal spray because my nose was always blocked, but I've since using that nasal spray daily. It took a while to kick in, but I don't need to use my Vicks spray as much, which is good because I'm not supposed to use it because of having high blood pressure, but it is also something that can cause rebound stuffy nose, So those allergy ones might be added in. Another drug that I take is called CYPROTERONE. That might be one you're interested in learning about. That is for polycystic ovary syndrome, so it's for hormone balance. I took it mainly because of my acne. That was the thing that I wanted to get rid of. I had really bad cystic acne that would come out in lumps and be very, very painful and really affected my self-confidence. And I would say a combination of low carb eating and the CYPROTERONE is what has helped my skin. But that is one that you only take on the first 10 days of every menstrual cycle. Now, because I've got polycystic ovary and probably also because of my age, I don't have regular periods, so you have to take it on the first 10 days of each calendar month. And interestingly, when I was prescribed to this, the gynecologist I saw kind of gave me free rein to mess around with the doses, which I can explain in a video about CYPROTERONE if you like, meaning I could take a quarter of a tablet for 20 days or half a tablet for 10 days or a full tablet for 5 days, things like that. And he said to feed back to him. But that was when I was working in the hospital and I was in research, and I worked with him on a few research studies. But CYPROTERONE is really good, and there's a lot of side effects. There's a lot of downsides to it, but it's also worked really well for me. And like I said, combined with low carb eating has eradicated almost my acne. You will have seen, if you follow me on my beauty channel, that I had a big lump under here. I've still got a scar. When my makeup comes off, you can see it because it takes a long time for not a scar, a red patch. It takes a long time for the redness to go away. It takes a long time for the spot to go away. And that was one of those big lumps. And that would have been because I had something like if I have wine or if I have pizza or just a lot of bread, a lot of carbs, I do get those lumps come back. And before going on CYPROTERONE, I did try to see if low carb eating alone would solve it, but it didn't. It made it better, but it wasn't the solution. So first 10 days of every month, CYPROTERone acetate it's called. Another drug that I take as needed is called METOCLOPRAMIDE. I used to take Motilium 10, but that is now not recommended, so I take METOCLOPRAMIDE, which is sort of an indigestion tablet, but it's more working as an anti-nausea, and so I use that if I've had to take a big dose of codeine, and just if my indigestion has been bad and those two things coincide, it can make me feel really nauseous, and so that's something to help the nausea. So again, that's just as needed. I also have a prescription for diazepam, which is, I'm only on 5 milligrams. I actually thought it was 10 milligrams because I was telling the dentist what I was taking, and I went to one of my appointments and I didn't feel that calm, and she said, I can't believe 10 milligrams has made no difference to you. But then I found out that it was 5 milligrams and I'd actually only taken half of it, so it wasn't very much at all. With diazepam, I only get, like, it's not on a repeat prescription. I get 14 tablets and I get it about once every 6 months, so I don't take them very often. They are prescribed as a kind of first aid, if you like, so I use them for panic attacks, planes, dentist, and the really bad migraines that I get, or the really bad headaches that I get when they are unbearable. A diazepam seems to just knock me out enough that I can sleep through it, and you know, it helps that way. So there's a few things I use that for, but yeah, not many at all. I suppose that would work out about 2 a month, something like that. Did I say there I get the prescription every 6 months? Yes, so about two a month. Another thing I take is Tramadol as needed, and I very rarely take that, but I'll take that if my head is too bad. It's only really for my head that I'll take it. No, that's not true. I did take it for my indigestion. I think I got it at the hospital because it's not something I have on prescription. I don't know how they'd be if I went in and asked for another prescription for it, but it is something that really helps. When I had that really bad indigestion pain that was like all in my stomach and back and chest, I did take some then, and like I said, I take them for the headaches if things get really bad. Again, for indigestion, I've got BUSCOPAN, which is to stop cramping, and so I take that if I have any really bad episodes of these stomach cramps. And the other thing I sometimes take as well is Rennie. They're little mint sweets, because that's something else you can take on top of the stuff that I'm taking. And you know, when I've got that really bad pain, I'm just desperate for anything to work, if you like. And then the final thing that I take as needed is, or don't take, but it's ibuprofen gel. I can't take ibuprofen because of this indigestion issue, so I do get prescribed ibuprofen gel, and I can use that, yeah, as and when needed. I also get prescribed Differin, by the way, which is adapalene, which is a cream, and that's for acne, but I don't use it that much. So that's everything that I currently take, but like I said, there's been an awful lot of things that I have tried over the years for the various conditions. I was on metformin. Metformin is a diabetic drug, and the reason that I was put on that is because of this hyperinsulinemia that I talked about in the conditions video. So it's related to the polycystic ovary, and metformin can be used for polycystic ovary, although it's not widely used. I was lucky to be prescribed it, I think, but I didn't get on with it at all. It's another one I'm happy to do a video on. I did not get on with it. So I tried that. For polycystic ovary, I have tried something called FINASTERIDE, which is really quite a strong drug, and it's something that I had to sign to say that I wouldn't get pregnant, or that, you know, I was aware of the risks, because it can be very damaging to babies. And again, that worked for a little bit, but then didn't work at all, so that was a bit of a failure. I've probably tried other things for polycystic ovary that I can't think of. I don't think there's that many drugs out there, you know. TOPIRAMATE I tried for my headaches, and I've done a video on TOPIRAMATE. I think it is up on this channel. And I've tried a lot of drugs for my bladder, so I've tried SOLIFENACIN and OXYBUTYNIN, which are they're both the same type of drug. And they haven't really done, well, no, that's not true. It's not that they didn't do anything for me. They did work, actually, but they made me feel terrible, and it wasn't a terrible that I could bear with and try and see if it passed. I did, you know, stay on it for, I think it was about a month, and it wasn't getting any better. The symptoms were the same, so I gave up on that. I've been on antibiotics before, long-term antibiotics, to see if that would help the bladder situation, and it didn't. I'm not sure how long I stayed on them for. That's something I want to check with a GP, actually, because I think it might be something I'd consider again. So that's everything that I am currently taking, and the ones that I can remember that I have taken before. If you would like me to do a video on any of those, telling you about how they've helped, what the side effects are, what I think of them, you know, as a long-term use. I always look at the long-term use of drugs and see what research there is out there, and whether it's something that's dangerous long-term, because it's not something that the GPs generally tell you about. Then I'm more than happy to do so, so let me know. I hope this was interesting. Thank you so much for watching, and I'll speak to you soon.